here this morning. We have we're all set. Start with the pledge. I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, trust you've all had a chance to look at previous month's minutes.
So approved. Second.
All in favor?
Aye.
Okay. Moving on from that, our grand list of resolutions is 1, AG1, resolution authorizing health department request to transfer senior typist position 418-921-901 from hospice to health administration. Eric, could you give us a little more explanation on that?
I'll make that motion.
I'll second.
Thank you. Okay, very good.
Due to the closure of our hospice and the need for the management of our bereavement cases coming to an end, we only carry one case right now. We're requesting to move that last remaining hospice staff, which is our senior typist, into the admin department, which will allow her job duties to be funded through Article 6, which is wonderful. That's a cost savings of $5,928 for this year. And she can help with accreditation and other duties that are needed. Accreditation is a big undertaking. And moving forward, she's already been working in that area, so this will allow us to bill Article 6.
Mark, can you explain the purpose of accreditation for people so they understand why you're being accredited?
Oh, accreditation gives us accountability to our residents. I believe that it's the biggest. It will also help to secure funding.
That's good.
Frank?
Do we need a petition request form for this? No. We need a petition request form for this resolution. Transfer senior typist line from hospice to administration? No, it's just transfer. No? Okay. I just want to know, is that creating a position? Okay. Okay.
But this is the only position left in the hospice program.
That's correct. We do have staff that is well versed in the bereavement program that will finish out with the last remaining
And
family.
that goes to the end of this year. And it's done. Or
If we're not going to make it to the end of the year, I believe the discharge of the last patient in September, the last family. So hoping that Sencha will have everything in place before then.
any other questions? Anybody have any other questions? All in favor of this?
Aye.
Opposed? Carried. So, right along, the next area is blank, committee review and decisions. So we have health department updates and your report.
I do have the professional advisory committee minutes that everybody did receive
Mhm.
and hopefully had a chance to review them. This is just standard operation where I need approval for these also.
I'll move it.
I'll second.
Okay, so we could vote on that?
Yeah.
All in favor?
Just-
Just approval? Okay.
Thank you.
Yeah.
Ready for my update?
Yes, ma'am.
It's gonna be the fastest meeting on record.
August.
So we're quickly moving towards the budget season, and all of our preliminary meetings have taken place with each of the divisions. The final meetings are scheduled for August. We are also working with the Wildlife Service Program and the U.S. Department of Agriculture to distribute the oral rabies vaccine bait to the wildlife. That's going to take place tentatively, weather permitting, from August 10th to August 15th. We did send out a press release on that also. Thank you, Kelly. Health educators are working on setting up dates for evidence-based fall classes, stepping on chronic disease self-management and diabetes self-management. We presented more than sad to the educators at the Fulton City School District summer staff. 2 classes were held in July. It was very well attended, and we have 2 more classes scheduled in August. We distributed the KN95 masks in response to the air quality. They went to all the county clerk's offices, and we also distribute some to the flood cleanup efforts. Mosquito dumps have been distributed also across the county. They were handed out with the masks to the county clerk's offices. And also in collaboration with Soil and Water, we have dumps available at the health department also for residents. And Kelly's actually putting together a press release for that right now. The fellowship members have developed some activity books for children, the benefits of drinking water, summer safety, and mental health. We are also seeing an increase in appointments for car seat installation, which is wonderful. We teach them how to properly install car seats. We also provide car seats to anyone that meets certain criteria. We are partnering with Traffic Safety Board to provide bike helmets to kids that come in for their immunizations. Working on a billboard campaign for flu shots and general immunizations. I do have a template. And I don't know if I should work with travel and tourism on this, or if this committee would like to see what we're working on. I'm not sure if I like this, but I'd like your thoughts on it. If we could pass that around, well, I can
How does it
continue
go
on
along with the billboards we approved?
So this is, because the billboards go for the full year. So we don't want to do back to school only, we want to do back to school up until September, October. So a couple of the billboards, we need to start advertising for flu and then other immunizations. So this one is for the flu shot, which will be for flu season. And then hopefully develop another one to continue, because we don't want the same message up there the whole.
Okay.
Does that make sense?
Yeah, is that the grant, this is the grant money?
Yes.
We're not, okay.
No, this is all completely funded.
So the billboard messaging is different than what you're proposing for this possibly?
That is for the billboard, but this is for, so, say October, November, December,
Okay, different season.
right? Because back to school only goes till October. They should all be vaccinated. If not, they're all kicked out and we have to vaccinate them. So. Just,
I want to thank you for the rabies map that you sent out, for the drops, for the bait drops.
Yes.
I've been asking about that.
we just got the letter. Yes.
Yeah, so I appreciate you sharing that with everybody.
Yes.
Make sure we want to target them.
Yes, we are. So good stuff.
I like that design in that, it shows family, get the family vaccinated, but it also, as you read it, it's pretty simple, and it points down to the phone number. So I think that's actually probably pretty good.
Okay.
Yeah, and with the time of the season with the snow on there as well. Just,
Right, and that will be
along
the
with it,
December
coincides with it.
Yeah.
Right. Okay, good. Thank you. I appreciate it.
Who came up with that?
One of my health educators, a fellow, which is communications. She works with communications. Yes. Okay, so that's the billboard, and then we are working on some bus ads for shelters and maintaining and managing high blood pressure. This is based on some of the data that we've collected through the death certificate for primary hypertension, and we're really seeing that regularly in our death certificate. So we are moving forward with that. And then we continue with our seasonal and monthly newsletter. Our overdose to action, the preliminary planning is underway for our overdose fatality review team. This is the team that's going to be co-led by our coroner's office. We are participating in a statewide overdose fatality virtual meeting to connect with other counties that are working on or already currently running an OFR.
Do you have the statistics on how many people overdose here in this county?
I do, and it's gonna get better because of my next bullet point.
Okay.
So, me, including 4 other staff members, have access now to, it's called bispatial system. It's the EMS data for all overdoses. This data gives us the ability to look at it more complete. We were only receiving about 50% of the data for overdoses in our county. So now with the EMS data, we're gonna get, it's not gonna be 100%, but it's gonna give us a better, clear picture. So more to come on that and the data. And I'm more than happy to share it with you as soon as we get it together.
Yes, because we've talked about it before, we're becoming more data-driven in all the actions and preventions that we've done and everything. That's gonna be excellent.
It is gonna be excellent.
Before, we just didn't know.
Right.
Richard would always say, is any of this doing any good?
Right.
Now we can see the numbers.
Yes, through this contract with New York State EMS, I can't give anyone access to this site, but we can get the data and present the data summary, which we will do.
You said you received this through the coroner's office?
No, we're working
Okay.
with the coroner's
Working
office
with
and the
them.
DA to co-run our OFR, our overdose fatality review team. So we can look at deaths that happened in the county from overdoses, and based on that data, work to do better.
All right, because when we were talking about this machine going into Fulton, it was based on data that allegedly the University of Buffalo or whatever the heck it was out there,
Yes,
they came up with this. How did they come up with data saying this, if we don't know?
but we're just ranked higher. That's how they rank us per counties, and if we have a higher overdose rate, and they can be looking at hospital data, which we have access to. They can be looking at the OD map, which we have access to. The piece that we were missing was the EMS data. So real time, someone is found unconscious, EMS goes to the site, change it over to an overdose. No one sees that data. Now we can, which is wonderful.
Now, incorporated in this data, does it also have the number of people or the agency's information if they went out and say Oswego or Phoenix or wherever, and they give somebody Narcan, they save their family instead of letting them die?
Narcan data is included in that also, how many doses and how much will be provided. And if it's multiple visits. And we can see if multiple doses were provided.
Because, we can't.
It is the most real-time data we're ever gonna get.
Like I told you, statistics don't lie, people do. We have to know the statistics of where they're at.
Yeah, we've been pushing. So we did sign a contract so we can have that data. Okay.
Will that be shared monthly? How are you gonna try and present that for us?
I'll just do a quick summary, and I can do it as often as you want. I
Or
mean,
the-
if you would like it monthly, we can do it monthly of how many overdoses.
I think I'd like to see it monthly until
Got
such
it.
a time we get tired of seeing it.
Yeah, see,
Okay.
that year is a big
Right.
problem.
That
and-
way
I can
you
just
guys
add it
keep a
for-
running account on how the direction that it's going.
Probably be able
Well,
to track that.
it's,
Yeah.
it's bad all over the country right now.
Yes, obviously.
We can also look at medications that were overdosed on, if blood work was conducted. So, okay, very good.
That's it?
That's good stuff. No,
I have
I'm
a
not done
question.
yet.
How are the rabies clinics going?
very good. I'm coming. It's coming. I'm coming to that.
Oh,
Not done yet.
I thought she was done.
She was, she said she was done.
I'm really close to it though.
Okay.
So our fellowship program, we submitted an abstract for our fellowship conference in December, and hopefully that will be accepted. Epidemiologist fellows will be attending an upcoming training on grant writing, and I did work with HR to include grant writing and assisting with grant writing into the job description. Our expedited partner therapy, public health detailing will start up soon. We're hoping by the end of August. And then the state is planning for a site visit for our fellowship program this summer. So I would guess sometime in August. Which I think our fellows program is amazing. So they always ask us to come to the conference, speak at the conference, and so really good stuff. Environmental Harbor Fest. So, last weekend we permitted roughly 40 food vendors. Most of the food vendors were in Braybeck and East Park, with a few miscellaneous locations. We continue to work with legal on our vape shop violations. Their children's camp have been keeping us very busy. They're working out a certificate, make paperwork, and not following up with safety plans. So we've been working with them individually, and we have redesigned our letter that goes out at the beginning of the season next year to address all these issues to make sure that does not happen again this year. We are working on revising our fee schedule and fine schedule for the whole department and environmental. The last time that was done was 9 years ago. So we're looking at that. We'll bring it to Board of Health, and then it will be presented to you after Board of Health thinks it's an okay list. We're pretty close. We'd like to include it into the 2024 budget with the increases. Public health nuisance complaints, we opened 42 so far this year. Currently, we have 22 open, 5 garbage, 16 septic, and 1 rodent. Facility complaints totaled 40 this year, 29 were closed. So that leaves 11 open. That includes 1 of TUPA, which is adolescent tobacco, 6 food service, 3 mobile home parks, and 1 temporary residence. Our cooling towers non-compliant. I'm proud to say that we are at an 84% compliance rate now since the first quarter, where we were at 67%. 72 open lead cases are being followed. Our vector surveillance, we tested 9,300 mosquitoes this season, no positive pools of Eastern equine, yes, or West Nile. So we have 40 pools that we're keeping a watch on, and we pull mosquitoes from pretty much daily. And a full pool is 60 mosquitoes. In case you're wondering what a pool means, it means 60 mosquitoes. Our rabies clinic data on the 12th was the Granby's, which was our largest at 222 animals. We had 178 dogs and 40 cats and 4 ferrets. And then on the 19th, we finally got to hold our Hastings clinic, where we provided a total of 82 vaccines to 66 dogs and 16 cats. So numbers really low at Hastings.
Well, it's because that had to be rescheduled several times. Well,
Twice.
2 times, right? Yeah.
Yes, which was awful. The first time we had, I think we lost about 15 people. Hopefully they went to Granby. A total of 7 animals so far have tested positive for rabies, 1 bat, 2 fox, 3 raccoon, and 1 skunk. 39 animals have tested negative so far. And post-exposure treatment, we authorized for 21 people. Our preventive immunizations, we're gearing up for back-to-school clinics. Our clinics on Tuesdays, you can tell that we're starting to run back-to-school clinics. Our lobbies are getting full every Tuesday, and we're adding on several additional clinics to meet the needs. Healthy families, Oswego County, we have 26 families. Our state visit is tomorrow. We have been taken off the watch list, which is really good news. That means that we're actually meeting all of our performance targets or very close to meeting our performance targets. Early intervention, child find 22 referrals received in July. 176 children are still waiting for services or on our wait list, and 40 committees for preschool meetings have already been held. That's what I got.
Can you just elaborate on the 176 children that are still waiting for service? What exactly is that they're waiting for?
It's therapy, there's like physical therapy, speech therapy. It's the therapies.
Thank you.
You're welcome.
How often do they go out and check those mosquito traps?
It's pretty much daily. We have to make sure that the rusting boxes can go a little longer. We have to make sure that the dry ice is in there. So even if we're not collecting the mosquitoes, but we want them alive when we collect them, and then we freeze them, and then we pull them out and look at them per microscope to make sure that
That's
we're.
gotta be interesting. That's crazy. Is the environmental division under your jurisdiction?
Yes, it is.
I was told that they're going to do the spraying in the river.
There's no plan for any spraying until we get a positive triple E or West Nile.
I mean for the water chestnuts.
Oh, for the water chestnuts,
Up and
they
down.
do, and we get notification that they're doing that. That's normal. They do that every year. They just send us a letter. It's a nice letter saying that we are conducting the spraying for the water chestnuts.
Person in Soil and Conservation Board approached me and said that DEC finally okayed it because they divided it into two portions. The holdback was because the country club draws their water from the river,
Mhm.
and they didn't want any of those contaminants on the golf course.
Interesting. They sprayed last year.
Yeah, and so they divided this year, I don't know where they divided, but there's upriver and downriver, a number of weeks in between, and they okayed it, says that'll pose no problem. So they got to clear on that.
Yeah,
People ask about
we get the
that.
letter that they're spraying. They just let us know, but there's nothing that we do about it. So it's a good thing it's an invasive species.
Yes, yes. I was on a detail when they first happened over in the Ox Creek area. I was working there. The first time they tried to harvest those with a machine, with an underwater sickle bar type thing. They didn't capture a lot of them, just start floating down the river like that. So I asked the fellow, what does that do? He said, every one of those plants will propagate 11 plants.
Wow.
And that was a number of years ago. And then after that, they tried to catch them, but it was too late. Once they're out there, the current just carries them down the river all the way down to Oswego. So now they're trying to pull them out by hand. It's a nice
Gesture.
idea, nice gesture, exactly, but they just won't make it. So they're finally doing the spring to get them under control somewhat.
Right.
Richard?
Europe, last weekend, as soon as you were I was reading the paper out of Utica, and in it was a large article dealing with mental health, and Governor Hochul put into the budget. It was approved quite a lot of funding for mental health.
Mm-hmm.
What have we seen come to our county, and how are we dealing with this?
I would believe that comes to the mental health and hygiene division in the county.
Yes, that's at DSS, that.
It's through DSS. We help with
Well,
we do a
So
little
we don't
mental
see
health.
that at all. I mean, her department doesn't deal with that.
We do a little mental health, but it's not at that level.
All right, one more quick question.
Sure.
The car seat installation, doesn't our local law enforcement do this also?
They do. We work through the traffic safety. And we have a few staff that are trained on car seat installation, so we help with that. We've been doing it for years. It's good. It's a really good program.
No, I'm not saying it's bad. I hate to see duplication.
No, I think it's just easier for some families to come right to the health department, and we have a few staff that are trained in.
It's just, put them in rock.
Right.
Just
just refresh my memory a little bit on the cannabis dispensary. What do we have to do with that?
It's not under the jurisdiction of the health
We don't
department.
go out and check to make sure
Nothing.
that they're not having stuff that's not supposed to be
No.
sold.
It's
Just
the
a
Office
cigarette.
of Cannabis.
Just a cigarette.
This is cigarette and vape shops.
That's good.
No, that's really good. We at one time thought it was coming to
Yeah.
us. Yeah.
That's what I thought.
It's gonna be a big undertaking.
Any more questions for Vera or anything? Phil, you had something?
Yeah, ask the committee for a motion to go into executive session regarding matters leading to the dismissal or removal of a particular person or corporation.
Need a motion for
I'll make that motion.
For a second.
that? Okay, so
Goes on.
You get the second.
Wow.
Second.
Okay.
Okay.
All in favor?